The cervical vertebrae have special characteristics as they perform special functions. The special characteristics of the cervical vertebrae, C1 through C7, the C stands for cervical. The transverse foramina, transverse gives us a location, which is on the side, as in the transverse plane. The transverse foramina are here to allow for blood vessels. Another special characteristic of cervical vertebrae is known as the bifid spinous profes. Bifid, meaning there are two. There are also oval vertebral bodies and the vertebral foramina, which allow for the spinal cord to pass, are the largest in the cervical vertebrae. There are two atypical vertebrae. Atypical meaning different. The atypical vertebrae located in the cervical spine are the atlas, which is the C1 or first cervical vertebrae. It's atypical because it does not have a spinous process. No spinous process here. The second cervical vertebrae, known as the axis, is atypical because of the odontoid process or dens. These are atypical cervical vertebrae. The thoracic vertebrae has special characteristics. It has the longest spinous process. The spinous process of the thoracic vertebrae project inferiorly, so they angle downward. Other characteristics of thoracic vertebrae is that the ribs articulate here. The ribs articulate at the body and transverse process. It would be here. They articulate anteriorly to the transverse process. Here, there's a round vertebral foramen. The lumbar vertebrae have the thickest body. They have this thickness because they are the weight-bearing vertebrae in the vertebral column. The sacrum are 5 fused vertebrae. The fusion of the sacrum begins around age 16 and doesn't complete until about age 30. It forms a strong foundation of the pelvic girdle. The difference between the genders is that the female sacrum is wider, shorter, and more curved. Inferior to the sacrum is the very small coccyx. The very small coccyx. It fuses between the ages of 20 to 30 years old. Anatomically, this is our tailbone. The sternum or breastbone has 3 different parts. The superior part of the breastbone is known as the manubrium. The middle part of the breastbone is known as the body. And the inferior part of the breastbone is known as the xiphoid process. These parts fuse by age 25. The ribs. There are three categories of ribs. True ribs are ribs numbered 1 through 7. The reason why they are called true ribs is because they have their own cartilaginous attachment to the sternum, as you can see here. True ribs. The second category are false ribs, ribs 8 through 12, because they do not have their own cartilaginous attachment to the sternum. They actually share cartilage. They share cartilage. Floating ribs are ribs 11 to 12, as they do not articulate with the sternum at all and come off of the thoracic vertebrae. Rib structure. An individual rib will have 4 pieces. The shaft, which is the longest part of the rib. The head, which articulates with the vertebrae. Anterior to the thoracic vertebrae transverse process. The tubercles, which articulates with the vertebrae. The body of the vertebrae. And the costal cartilage, which is hyaline cartilage. The costal cartilage is represented here. The costal cartilage of the ribs.